Hi, thank you everyone for joining us. I'm Jonathan Modi with Oregon Health Authority External Relations. This is a media availability for reporters to ask questions of Dr. Sejal Hathi, whose appointment by Governor Tina Kotek as Oregon Health Authority Director was announced today. This media availability will be 20 minutes, so we will be wrapping up at right around 11:40, maybe a minute or two afterward. Just a few reminders. Please include your media affiliation so we know you are with the media. If you're not a reporter, you can view a recording of this availability on our website later today. That's the OHA website. Use the raise your hand function to be added to the queue to ask a question. You can also drop a question in the chat and I will ask it on your behalf. Please mute your audio when you're not asking a question. We'll take one question at a time. If you'd like to ask a follow-up question, we will take it when everyone has had a chance to ask a question. Please send a note to Elizabeth Shepard, Deputy Press Secretary for Governor Kotek, or Rob Cowie, OHA Director of Communications, if you have any follow-up questions. Finally, if you'd like a link, can't find the recording of this media availability on our website, feel free to drop a quick note to the PIO staff at OHA at phd.communications@oha.oregon.gov, and we will send you that link after the media availability is finished. With that, I'm very excited to welcome Dr. Hathi to Oregon and to OHA, and I'll turn it over to her now for some brief remarks.
Thank you so much, and good morning, everybody. Thanks for being here and taking some time to meet with me. I know this will be just the first of many conversations we share, so I'm delighted to be able to offer some background about my journey. So firstly, I'm a physician, a primary care doctor, and an internist. I'm a public servant, a former social entrepreneur, and I'm a first-generation American. And since my youngest years, I have been obsessed with fixing what is broken, finding, understanding, reforming those structures and institutions that entrench social inequities and compress the human potential. I come from a family for whom subverting such structures was once cardinal to survival. My parents, both born and raised in Africa, arrived in this country with little more than a passport and burgeoning dreams. My dad as a political refugee from Uganda, and my mom as the youngest of 8 in Tanzania. And as the fruit of their journeys, their quest to attain the American dream, I have been raised with a conviction in the American project and in the principle that how we reach out and touch the world is how the world will reach back and shape us in the future. And so this is the spirit that I have sought to bring to all that I have pursued and all that I have done, from my work in grassroots civic advocacy to more recently, my service in the Biden-Harris administration at a pivotal moment in our nation's history. Across all of these experiences, I have fought for a world where health is not hoarded as a privilege by the few, but is democratized with intention as the birthright of all people. And to my core, I believe no other state in its team, its leadership, its politics, its very constitution is as primed and as well equipped as Oregon to model how this should be done. I know that this is a state and a team that embraces my values for equity, for evidence-based policy, for innovation and relentless improvement. I've had my eye on Oregon for quite a while, and I could not be more excited to make this state my home. So thanks very much for welcoming me, and now I am excited to take your questions.
Thanks, Dr. Hathi. Again, please use the raise your hand function that's under the reactions button at the bottom of the screen to be put in the queue to ask a question. Our first question comes from Lynn Terry with Oregon Capital Chronicle. Go ahead, Lynn.
Yeah, hi, welcome. Congratulations on this new demanding role you're taking on. I've got a bunch of questions, and of course I won't get to ask them all, but you're very young and obviously, very accomplished, kind of a wonderkin, but taking the lead on this agency, 5,000 employees about, and they're used to having, you know, crusty white men, middle-aged white men lead. You know, how are you going to approach this challenge? Because surely there, you know, you're going to get some pushback because of that.
Thanks very much for the question. It's a fair question. My age is certainly a topic that has come up before, but let me make one thing clear. I harbor no illusions about the path ahead. I know it will be hard and long and full of challenges, but I'm committed to that journey. And even in my short lifetime, I've had the privilege of living multiple lives, from my earliest years as a teenager, starting what became a global nonprofit, to most recently serving in the highest levels of agency leadership in New Jersey, where I similarly had to wrangle a lot of difficult perspectives and bridge silos, entrenched silos, to push the work forward. And that is that grit and commitment that I will bring to this role. And I know at the same time that there is no age requirement for getting the job done. My job is to keep and fulfill the promises that the state has made, that the governor has made to the people of Oregon. It's to steward our critical programs. It's to meet budget. It's to execute on our priorities across behavioral health, public health, our groundbreaking 1115 waiver. And I am prepared to do that. I am prepared to do that in partnership with the governor's team, with the incredible staff that have been working in the trenches at OHA, and with all of you, because I know that we will keep each other accountable. And it is going to take all of us, but I'm excited to get started.
Am I allowed to follow up?
Yeah, Lynn, if we could, we'll come back to you.
Okay, sure.
For a follow-up, but thank you. Next question comes from Angela Yamamoto with K-Val. Go ahead, Angela.
Hello, and congratulations on the new role. I was just wondering what your reactions were to taking the only emergency service healthcare facility from the third largest city in the state, and what the plans are to rectify the situation.
So Angela, you're coming in with the hard questions early and fast. I like it. Let me tell you that I have a lot to learn, and I look forward to learning more about that and coming to you in future weeks with a plan for how to rectify that, in your words. So more soon.
Thank you, Angela. Next question is from Amelia Templeton with OPB. Go ahead, Amelia.
Hi, nice to meet you. In the deputy role that you've been in New Jersey, what was the size of a budget that you were overseeing, and how many people were directly reporting to you?
Sure. So in New Jersey, we had a little over $2 billion under me, and about 13 direct reports, with about 1,000 non-direct reports under me.
Can you clarify just who the non-direct reports were, what the difference is between the 13 and the 1,000?
Sorry, so 13 direct reports report directly to me, and then 1,000 people that I'm additionally responsible for.
Thank you.
Sure.
Thanks, Amelia. Next question comes from Jayati Ramakrishnan, with the Oregonian. Go ahead, Jayati.
Hi, I'm Jayati Ramakrishnan with the Oregonian. Congratulations. So the state has struggled to provide adequate housing for mental health patients. The state psychiatric hospital remains at capacity. So I'm wondering, what are your plans to focus on behavioral health services in Oregon? And do you have thoughts about how to address the challenges that the state faces? And will your work in New Jersey inform these specific challenges?
Thanks, Jayati. So shoring up our behavioral health system, building an infrastructure that ensures that any Oregonian from Pendleton to Portland can get the treatment that they need and deserve at any time where they are, is one of my core priorities, as it is one of the 3 principal priorities of the governor. And so I'm really looking forward to working with our team and our partners on the ground, our health systems, our community-based organizations, and the governor's staff to advance her priority of building a robust and resilient behavioral health infrastructure. Of course, paramount to that goal will be ensuring that we are investing adequately and responsibly, not only in treatment services, but in the wraparound navigation, social services, housing that we know underpin the success of our behavioral health programs, and that in many ways precipitate poor behavioral health outcomes. And so there is a lot of work to be done, and I know that, but that is one of the areas that I'm most excited to delve into. And it is one that I feel I am prepared, both from my time in New Jersey and my time at the White House, where I was specifically responsible for these issues, to delve into too. So thank you.
Thanks, Jayati. Next question comes from Brenna with Coin TV. Go ahead, Brenna.
Hello, and congratulations on the job. This is basically, you're a unknown quantity to a lot of Oregonians. So what is the message to Oregonians? Like, how are you going to change OHA or improve OHA? What do you want to accomplish?
Thanks for that. So let me just say, one of the reasons I'm most excited about coming to Oregon is the team at OHA. I have immense respect and admiration for the staff there, and I could not be more grateful that they have given me this opportunity to lead the work of the agency in partnership with all of them. So there are ways that we can strengthen the agency. There are ways that we can improve and ensure accountability for the work that we are called to do. But let me just note that even now, prior to my coming in, I'm incredibly proud of and inspired by the work that the agency has done, and by the leadership of current acting director Dave Baden, who has stabilized and supported the agency, especially throughout these past few months. So I'm excited to partner with him as well in the months ahead. But more pointedly to your question, I will be the first to acknowledge that I am not from Oregon. I haven't lived in Oregon, though I'm thrilled to soon be able to say my family and I hail from this beautiful state. But while I may not have grown up here, that doesn't mean that I don't share a fierce desire for our families to be healthy and successful and safe. I want to serve my community and all Oregonians who rely on state programs with rigor, with urgency, and with care. I want to accelerate and to center our quest for health equity. I want to wrest as much value out of every taxpayer dollar that we spend. There is a lot of work to do here, and we all want many of the same things. And so it's from there that we will start. And I look forward to learning as much as I can and listening to all of you on the ground who have been doing this work day in and day out over the months ahead.
Thank you, Brenna. Next question comes from Sydney Wyatt with the Statesman Journal. Go ahead, Sydney.
Oh, there we go. Hi, nice to meet you. Congrats on your position. Similarly to the question about behavioral health, but we also know that substance use and access to treatment has been an important issue in this state. And I just want to know, like, what are your plans to increase residential treatment or continue the work that's already being done? And is this something you're going to prioritize in your first year in the new role?
Yeah, so I am definitely going to prioritize it. It's one of my top priorities, alongside workforce and public health infrastructure and implementing our 1115 waiver effectively. But there, I almost want to turn that question around to you. One of the first things I'll be doing as I come into the role and over these next several weeks and months is meeting with stakeholders on the ground, doctors, nurses, social workers, peer specialists, community-based organizations that are meeting people where they are and asking them, what do you think we should be doing? What are we not doing? What should we be doing more of? And there are a lot of different ideas for how to address this challenge. I know that this is a topic of significant interest and debate throughout the state, and especially in Portland and in Salem. But I am hopeful and optimistic that we will find the right path forward so long as we center the voices of the people that are affected by this crisis most, the people that need this treatment, that are in recovery, that are on the streets. And so it's also in partnership with them, by listening to them and to the community-based organizations that work with them, that I hope to move forward.
Thanks, Sydney. Luke, with KDRV, did you still have a question?
Sydney basically asked my question, so.
Okay.
But welcome to Oregon. Glad to have you here.
Okay, thank you. We have some follow-up questions here. One from Lynn Terry with Oregon Capital Chronicle. Go ahead, Lynn. Lynn, you may be on mute.
Sorry. I don't know if, yeah, I'm curious about two things. I don't know if you've heard of the Oregon Way. You come from, although you grew up in the Bay Area, you come from some high profile, high powered situations there. One might not say that of New Jersey, but you know, it's the East Coast and people talk faster, they move faster, although things don't always get done faster. There's a thing in Oregon called the Oregon Way, where it involves, you know, creating endless task forces who come up with endless studies, who then create endless task forces about the studies. It's, you know, it's kind of labored, let's put it that way. You know, how are you going to maneuver in that environment? And I also wanted to ask you why you're leaving your job after only 4 months.
Excellent questions, Lynn. So if you're asking me how I plan to navigate bureaucracy, let me just tell you, I'm no stranger to bureaucracy, and we've experienced that in New Jersey and at the White House. And in some ways, you know, these processes and protocols are in place to ensure that we are being thoughtful, that we're being inclusive, that we're being equitable, because each of our decisions can have profound and intergenerational impact. So there is value, if you will, to redundancy, and in some ways to the types of bureaucracy that you're alluding to here. But I'm an operator, I'm a builder, I like getting things done. And I fully expect to come to the state and work with urgency on the problems that have been plaguing us for quite a while, with respect for the process, but also impatience to get the job done. And I think you do that in part and foundationally by building trust and making sure that you really understand why people are making the decisions that they are thinking in a certain way, or biased toward one path or another. And that is why I think it's so imperative for me over these next several weeks and in my early tenure at the agency to invest in building those relationships, putting my ear to the ground, and really trying to better understand, largely because I haven't been there, but also because this is what ensures sustained success, why people are approaching the problems that they are in the ways that they are, what their fears are, their priorities are, their concerns are, because that's how you build trust and that's how you push the work collectively forward. And so broadly, that is the approach that I would take. As to why I'm leaving New Jersey, I would say that it's because of the incredible opportunity that the governor and the governor's team were gracious enough to present to me here. Oregon, I've had my eye on for years. When I was at the White House, we looked to Oregon as a leader in expanding healthcare access and coverage, in addressing the structural impediments to good health, from food insecurity to homelessness to poverty. Oregon has always been at the vanguard of bold, progressive, and imaginative policy. And the opportunity to shape that, to be a part of that legacy, to join that team and accelerate that progress was just ultimately too compelling for me to forego. At the same time, as you pointed out, I'm from the Bay Area. My family to this day resides in Northern California. My husband spent a formative part of his years growing up in college and beyond in this region. And so we've been searching for a way to return to this coast, to reestablish this coast as our home. And so in some ways, this feels like a bit of a homecoming to us, an opportunity finally to lay down roots where we wanted to, and to serve our broader community here. So we're really excited about that too.
Thanks.
Thanks, Lynn. We will get to Amelia's and Angela's follow-up questions. We'll go running a little bit over. We started a little bit later thanks to my blabbing. So we'll just go a few minutes over and kick it off with Amelia's follow-up question now. Go ahead, Amelia.
Yeah, you're stepping into an agency that's been through the shock of the pandemic and everything that it took to completely realign their priorities to respond to that, and then to coming up on a year with interim directors without steady leadership, with a lot of turnover. What will you do for morale at the agency? What will you do to stabilize that situation?
It's a good question, and it's one that I'm thinking a lot about. I would say that I'm a relationships-driven leader. I aspire to be and try to be a people-driven leader, and I think I see my responsibility as supporting and fueling the efforts of my team and empowering and elevating them. And the way that you do that, again, is by listening and by building trust and by meeting with folks on the ground doing the work and ensuring them that, one, I am here to stay. I don't view this as a gig that I would do for 2 months, 2 years. It's something that I want to do, that I'm committed to doing for hopefully 2 terms, if the team and the governor and the people of Oregon will have me. So I'm in this for the long haul. And secondly, I know again that I am not from Oregon. I haven't been in the trenches like the OHA staff have. I certainly have experienced my own fair share of trauma, as we all have during the pandemic as a frontline clinician and in federal and state government more recently. But at the same time, I'm here to listen and to learn and to try to build trust with the people that are doing the work on the ground to make their jobs easier, to ease the friction that keeps them from doing their job as effectively as they can. And that means a lot of listening sessions. It means a lot of meet and greets. It means not bulldozing my way through and imposing my own priorities in the first several days, weeks, maybe even months. It's about taking what works best, elevating and amplifying that, and then finding the cracks in the armor and trying to fix those in partnership with the broader team, and especially with my senior leadership team. So I'm really looking forward to meeting all of the staff over the coming several weeks and months. And I do believe that they have laid an incredibly strong foundation for the progress that I hope we will continue to make. And so, as difficult as these last couple of years has been, I believe that we are in a good place for accelerating and advancing the work that we need to do to fulfill the governor's priorities.
Thanks, Amelia. Last question comes from Angela Yamamoto. Go ahead, Angela.
Hi, thank you. So one of the biggest anxieties for Eugene residents is in the case of a natural disaster, no one in the city will be able to access any sort of emergency care because there's a river separating the 2 cities between Eugene and Springfield. And I was wondering if you had any initial reactions to the closure and if Eugene residents were deserving of having these services like all the other big cities in the state.
Hey, Angela. Sorry, this is Elizabeth from the governor's office. Angela, she has not been briefed on the Peace Health situation. So if I could ask you to reserve these questions for a future date when she's fully onboarded, she'll be able to adequately answer them. Thank you.
Okay.
Okay, thanks, Angela. With that, I think we'll wrap up. I just wanted to thank you all for being here and thank Dr. Hathi for joining us and welcome Dr. Hathi to Oregon and to OHA. If you have any follow-up questions, again, please direct them to Elizabeth Shepard with the governor's office or to Rob Cowie, Director of Communications, OHA, and have a great rest of the day.